Hello, I want to talk to you about some terminology that we come across in radiology a lot, and that's of acute, subacute, or chronic. When we typically think of these words in radiology, they're related to a disease process specifically. So for people that are working in skilled nursing facilities or nursing homes or something like that, it has nothing to do with the level of care that we're giving. So I know that in skilled nursing or in nursing homes, for instance, there's a big difference in the level of care in terms of how often you get to see the patient, what kind of services you perform when you're dealing with acute versus subacute care. So it's important to realize that these terms really don't have as much to do with that as they do with the way that either something looks on a radiograph or the duration of symptoms that the patient has had. So typically, when we think of acute, we're thinking of something that's going to be about 3 to 4 weeks old at the most. So it's from the time of the initial injury all the way out to about 3 to 4 weeks. If we're talking about something that's subacute, we're talking about something that's about a month old and extending out to about 3 months. And then anything after that 3-month period is really going to be called chronic from our standpoint. And so as an example, let me talk to you about fractures and how we would relate that terminology to fractures. So when we're talking about an acute fracture, we're talking about really the inflammatory stage of the fracture healing. So when the fracture first occurs, there's going to be a hematoma, so a blood clot at the fracture site, and that's going to call in all the inflammatory cells, and they're going to go in there and start working on the repair process. And so what you'll actually see in this inflammatory stage, which is occurring in the acute setting, is it can take 7 to 14 days for this process to occur. But so it goes in there and it starts, the inflammatory cells come in there and they recruit osteoclasts, and they will actually start eating up the debris of the bone that we're dealing with at the fracture site. So it's actually possible for the fracture to widen a little bit in that first couple weeks. So you may have a fracture that's initially impacted, and when it's impacted, we can't see it on an x-ray at all. So really you're looking at a CT or an MRI to see an impacted fracture. But by 7 to 14 days, that inflammatory stage has really got going full force, and that fracture lucency is going to actually widen. And so that's when we have a really good shot of seeing that fracture. Now the next stage that's going to happen after the inflammatory stage is the reparative stage. And that's where there's actually called vascular ingrowth. And the vascular ingrowth is where you grow all these capillaries and they start laying down a fibrous matrix, which ultimately will allow your body and your bones to start laying down osteoid, which is kind of reparative bone, on this matrix. Now the kind of interesting sidebar here is that's the stage that's most affected by nicotine. So if you have smokers, it really makes it hard for them to put down that collagen matrix to repair a broken bone. Likewise, with the inflammatory stage, so in the acute setting, if you give someone an anti-inflammatory, so an NSAID, so like Motrin or Advil, something like that, within that first couple weeks, you actually can delay the healing because you're preventing the body from having that inflammatory stage initially. So initially, acute is the inflammatory stage. That's going to be the initial setting. The initial time frame going with acute is 3 to 4 weeks. Subacute is 1 month to 3 months, and then chronic is after 3 months. And going back to our bone healing, our third and final phase is just going to be the remodeling phase. And so that's where all that osteoid matrix that we've laid down is going to start calcifying, and it's going to be remodeled until ultimately that bone gets to a point where it starts looking pretty similar to it did before there was a fracture, but it's going to take a while. It's that subacute phase of bone healing where we have to be really careful that we keep it casted, because any motion during that time can really ultimately go on and turn into a delayed union or something like that. So we have a hard time with the bone healing. So I wanted to make sure that we had a good understanding. We could apply that same date of duration for acute, subacute, and chronic to any other process in radiology or in medicine in general. The fracture healing was just an example. Thank you.